We'll put 2 minutes on the clock and your time starts now. All right, time is up, and hopefully we've got some answers coming through. So, ethical considerations, the components of ethics are a examinable and important part of the GP training pathway. It is something that is in our training guides and something we should be aware of and thinking of for our exams. I know I've put a few of these kinds of questions in recent weeks, and it's probably because I felt that it wasn't something that I'd had enough practice on when I was going through, so wanted to again highlight how important it is. Now, of course, what we have here is really that respecting patient autonomy. Patients are allowed to make appointments when there is something wrong, and if there's nothing wrong, they have the right not to make appointments. Likewise, they have the choice of also not making appointments when there is something wrong, and that is their choice. And so we should respect their choices if they haven't made appointments and not make cold calls. If, of course, we have an urgent result or something that we need to contact them about, that's a bit of a different story. But this is a bit of a dodgy situation of cold calls, just trying to generate a bit more billing. Not very great. So there is obviously not respecting that patient autonomy side of things. Now, it's already spelled out, and this is one of those good times where they've already given you the answer there. You just need to spit it back at them. And so ensuring appropriate financial consent in billing is... Lost the mute button for a second there. Is an important ethical consideration to take as well. So for all of our patient billing, we should be obtaining financial consent prior to the consultation. This is one of the reasons why practices will have the patient fees viewable in the clinic reception area or in the waiting area before patients go through. Likewise, maintaining patient confidentiality. Well, that is obviously not being taken seriously in this setting here, and so would be a very obvious breach and ethical consideration you would want to have a look at. So, of course, answers coming through. Again, thank you very much, Demir. We've got the privacy information inadvertently disclosed to the waiting room. You've ticked the box there for maintaining patient confidentiality, where the patient's privacy was breached on the patient's side. I think there's probably not enough information here, and I think there's probably a little bit of overlap with the last response, and so I would encourage you to try and diversify the answers a little bit. Of course, if you're kind of stuck and can't think of other things, feel free to put that down. I'm not sure if that would get an extra mark in this case here. Unsolicited... Pardon me, unsolicited private fee, yep, that's that financial consent there. And I think even with that wording there, I think you would get the mark because you're highlighting the fact that it is unsolicited. It's not something that was appropriately disclosed to the patient. So really well done there. Well done. Of course, we have more questions coming up. So let's get 2 minutes on the clock and your time starts now. All right, time is up. And again, we have one of those questions where it's almost like they're handing it to us on a silver plate, and you will get questions like that in the exam as well. Now, of course, we do have lots of things you could put there, and this is also a way I think they can tease out what are people doing in clinical practice as well. According to Medicare, the accepted measures of patient identification are the full name, you could specify that as given and family names, date of birth, residential address, not postal address, but actual residential address, and their Medicare card or medical record number. And so if they have a software specific or location specific, hospital specific MRN or identifier, you can use that as well. And I can see people put that in the chat there, so very well done. All right, nice easy one. Let's move on. Question 3. Let's get 2 minutes on the clock, and your time starts now. All right, time is up. And so, similar to the ethical considerations, processes review is something that is more than fair game in the exam itself. And I think it's also good that we have a good understanding in clinical practice day to day. So, this is taken from the Standards for General Practice, something that we should be aware of. We may not know all the nitty gritty kind of things, but we should have a decent understanding of what kind of recall systems we should be going through. Results are readily reviewed when received is probably a bit of a common sense thing that someone, as soon as the clinic gets it, is able to actually see that result there. Likewise, once it is seen, it should be electronically noted or signed if it's on paper and initialed when it's been read. Results should be acted on when required in an appropriate manner. So an urgent result's not just going to sit on the bench for a week. Likewise, it's not going to be filed away in a cupboard and forgotten about. It's going to be put somewhere that's sensible and appropriate for that result there. That result is then incorporated into the patient health records. So that result for a specific patient should be placed with that patient's files. And of course, there's a method from the practice to recall patients for clinically significant results. This process should also, there should be a process to manage urgent results that are received out of standard hours, so weekends or after clinic closes, for example. And this is actually a requirement for accreditation, so if you don't know if your practice has one of these, ask about it because it should be there. And likewise as well, patients are advised of the results follow-up system. So in the consultation or when you're talking to patients, you should be saying, hey, get these tests done. This is how we're going to be following it up. They don't need to be sat down and go through all this kind of fine detail, but they should be aware of how their results are going to be managed. All right, so a bit of a weird question perhaps to end on, but something that I again want to make sure that you're paying attention to and thinking about for the exam, because these questions very much are fair game.